This is a short video covering the subject of antiseptics, especially in their role in dental hygiene, but not limited to dental hygiene. Let's refer to our handout. So what we're looking at is section Q in the lecture outline on anti-infective agents. And right at the very top, we have a number of terms, few terms we want to make sure we understand the difference between. We have three words: antibiotics, antiseptics, disinfectants, anti-infectives. So what do these terms mean? So all three of these are antibiotics, antiseptics, and disinfectants, and anti-infectives. All four of those words refer to killing bad guys, killing bacteria, fungi, and even destroying, in some cases, viruses. What is the distinction between them? So antibiotics, as we wrote here, are selective. In other words, a specific antibiotic selectively and specifically kills or slows down the growth of a particular microorganism. So for example, penicillin V is taken orally, and it's specifically effective against gram-positive coccibacteria, among other things. Other antibiotics are specific against gram-negative bacilli. There are other antibiotics that are antifungal, so they are specific or selective. Antiseptics and disinfectants, which are collectively called anti-infectives, are non-specific, non-selective. In general, they tend to kill or slow down the growth of many different types of organisms, including being harmful to human cells. So as a result, because antiseptics and disinfectants are usually harmful if ingested or swallowed, because they are just as harmful to human cells as bacterial cells, in general, they are not taken internally. In general, there are some exceptions where they are used as mouthwashes or rinses, or can be swallowed if they are not well absorbed from the GI tract. But in general, they are used only externally and not internally. Now, the difference between an antiseptic and a disinfectant really just has to do with where it's being applied. If it's applied to human tissues, it's called an antiseptic. If it's applied to a non-living material, such as surgical instruments or what are called fomites, then it's called a disinfectant. In either case, they are collectively called anti-infectives because they decrease the growth or kill certain microorganisms. Now, the way that the antiseptics / disinfectants, or collectively anti-infectives, work is they primarily exert a non-specific action on proteins. Basically, they cause denaturation of proteins. They cause proteins associated with that microorganism to either to become disrupted and stop functioning. So they denature or precipitate proteins associated with a microorganism. They disrupt cell membranes by acting on the proteins in that cell membrane, or they inhibit microbial enzymes. And what are enzymes? Enzymes are chemically proteins. So basically, that's how the antiseptics / disinfectants or anti-infectives work. Now, there are two factors that affect the effectiveness of the antiseptic. Letter A, number one, the concentration or dosage used. In other words, the higher the concentration or dosage of the antiseptic, the more effective it becomes in killing microorganisms. And letter B, secondly, the exposure time. The longer the microorganisms exposed, the more likely it is to be disrupted. Now, these anti-infective agents are used for many purposes in the world of dentistry. They are used to reduce the number of microorganisms in the mouth, on the gingiva and the oral cavity. They are used in endodontics and periodontics to also reduce the number of microorganisms. And they are, of course, used in many OTC, over-the-counter mouthwashes gargles to reduce microorganisms. And in fact, currently right now, under COVID-19 conditions, when many patients go into the dental office, they may ask them to use a oral rinse, and we'll get to those, but they are most commonly either hydrogen peroxide or povidone iodine. Okay, moving on, page 2 or Q2. So we want to identify a few classes of these antiseptics. And the first class we're going to mention are called the phenols or phenyl derivatives. And the prototypical example is phenol. It also is known as carbolic acid. It was made famous by Joseph Lister, of who Listerine is named after. Joseph Lister used phenol or carbolic acid as an antiseptic on his hands before delivering babies from women, which greatly reduced the number of women who died as a result of childbirth by removing the microorganisms from his hands using phenol. Phenol, it disrupts or denatures the proteins of cell membranes. Again, these are non-specific, non-selective. It can denature proteins of human cells, just like bacterial cells. But again, it's usually used externally. It is bactericidal and fungicidal. It directly kills bacteria and fungi. It also has an antipyretic and anodyne action. Let me explain what those are. Pruritus means irritation. Sometimes it refers to itching or anything that's irritating. Antipyretic means that it counteracts the irritation. And it's actually called a counter-irritant. An example of that is that it actually stimulates tissues so that the person becomes less aware of the actual underlying irritation. And in so doing, it also has an anodyne action. Anodyne means it has a soothing action. Let me give you an example of what I mean. If you put clove oil, we're going to get to this in a moment, but eugenol, clove oil tastes like cloves. So if you had a cold sore in your mouth, which is associated with a virus, so it hurts, it's painful, it irritates. And if you were to rinse your mouth with clove oil or menthol, your mouth becomes so aware of the sensation or taste of menthol or clove that you become less aware of the irritation or pain caused by the viral lesion, the cold sore. So another example that's similar is that if you have muscle pain, people will put a product called Bengay on their skin, and it causes a warm sensation on the skin. And so you become more aware of this warmth caused by the Bengay and less aware of the pain associated with the muscles. So that's called an antipyretic or counter-irritant action. So it's used to reduce the pain or irritation of lesions or sores in the body, including in the mouth. It can be very toxic at higher concentrations. Some other products that contain phenol, which is effective as an antiseptic, is chloraseptic mouthwash or spray, which you take when you have a sore throat. And again, you become aware of the taste of chloraseptic or phenol and less aware of the cold sore or the sore throat that you have. Ambisol no longer has a phenol in it. It used to, but we'll get to Ambisol. Ambisol does contain benzocaine, a local anesthetic, topical local anesthetic. Camphophenique, you may have heard of, it contains phenol, and camphor. Camphor has a flavor of menthol, and together they both have antiseptic actions and antipyretic anodyne actions, again, acting as a counter-irritant and a soothing. It soothes the irritation caused by the lesion or sore. There are a number of other products that are in this class called phenols. They are chemically similar in structure. You'll notice phenol is basically a six-sided ring with an OH. You don't have to know that, but that's its structure. And here is cresol, which is very similar, and resorcinol and hexoresorcinol. All of these are used as antiseptics, disinfectants. They are all chemically, structurally similar to phenol and work just like phenol. On page 3, methylparaben has that similar six-sided ring with an OH. It is also a member of this phenol group. It has been used as an antifungal agent. Eugenol. Eugenol is worth noting. You should know eugenol. It is derived from clove oil. Notice its structure is that phenol structure with the six-sided ring and the hydroxyl or OH group. It's used as an antiseptic, as an antipyretic in mouthwashes and toothache preparations and flavorings. There is another product called Cavitec. Cavitec and other products that go by other names are ZOEs. What's ZOE? Zoe. Zinc oxide eugenol. So it's a combination of zinc oxide. We'll get to that in a moment. That's an oxidizing agent. And eugenol. Eugenol is like phenol. It is also an antiseptic. It kills bacteria and fungi. Thymol is derived from thyme oil. It is fungicidal, and again, it has that similar phenol structure. And perchlorophenol, also used in dentistry as an antiseptic and an antipyretic anodyne product. And lastly, hexachlorophene. While it looks a little bit more complicated, you'll notice that it really is made up of two phenol-like rings. Two six-sided rings that are kind of joined together with their OHs sticking out. And it is also has been used as a surgical scrub to kill bacteria and so on. Moving on to page Q4, alcohol. So a second class of antiseptics and disinfectants are alcohols. The two most commonly used alcohols are ethyl alcohol and isopropanol or isopropyl alcohol. Now, ethanol, of course, is also used for drinking. That's the active ingredient in scotch and vodka. But 70% ethyl alcohol is effective in denaturing proteins and being bactericidal and fungicidal. But again, alcohols are irritating when applied directly to the skin. We've all had a cut and applied either, probably not ethyl alcohol, but isopropyl or rubbing alcohol, and it causes a stinging sensation because it actually irritates and kills human cells as well as bacterial cells. A little bit more effective, more germicidal, more bactericidal than ethyl alcohol is isopropyl alcohol, rubbing alcohol. It's actually the 70% concentration is actually in many ways more effective than the stronger 90% concentration of rubbing alcohol. But anyhow, they are used as antiseptics and disinfectants. Remember, the difference between an antiseptic and a disinfectant just has to do with the what you're applying it to. If it's applied to human tissues, it's called an antiseptic. If it's applied to a non-living material, such as a surgical instrument, it's called a disinfectant. A third class of antiseptics are the biguanides, and the most important example of that is chlorhexidine, which goes under a number of brand names, include Hibiclens and Hibitane and Peridex and Periagard. It is also denatures bacterial proteins and is bactericidal. It is found in certain mouthwashes, again, to kill bacteria. And because it is poorly absorbed from the GI tract, it can't even be swallowed, although it's also just swished in the mouth and spat out. A fourth class of antiseptics, pardon me, are the surface active agents. These are antiseptics or disinfectants that have an electrical charge associated with the molecule. Now, if they have a negative electrical charge, they are called soaps. If they have a positive electrical charge, they are a surface active antiseptic. Now, the word anionic means negative. The word cationic means positive. How do you remember this? I always suggest to my students, notice that in the word cationic, it has that T, and a T looks like a plus sign. positive charge. Notice anionic does not have a T. It does not have a plus sign. That's a negative charge. So an example, we're just going to talk about not the soaps, but the positively charged surface active agents or antiseptics. On page 5, it includes benzalkonium, which goes under a number of brand names, including Zephyrin and Rocol and so on. Notice here's its structure. It has a plus charge. You can make it out a little bit right there. It's got a negative charge chloride associated with it. What it does is it is attracted to the negative charge proteins on the surface of bacteria and fungi, and it is disrupts them. It breaks them apart. And so in that sense, it's bactericidal. Another one of these surface active agents, antiseptics with a positive charge, is cetoperidium. It goes under the brand name Seprin. It's found in Cepacol mouthwash. And again, it has a positive electrical charge. Methylbenzethonium is the active ingredient, the antiseptic in Bactine that is applied when you have a cut to kill bacteria. It's also found in Diaperine, used for infants. A fifth class of antiseptics are the oxidizing agents. These are very important. They include hydrogen peroxide, which goes under, sold as generically, and it goes under a number of brand names, including Peroxyl. And what hydrogen peroxide does is it breaks apart into oxygen, and it releases all this oxygen. And there's an enzyme in our cells of our body called catalase that promotes that. But anyhow, it will break apart even on its own. And it releases oxygen, which is very effective against killing anaerobic bacteria. For that reason, hydrogen peroxide has been used in the treatment of Vincent's infection, or ANUG, acute necrotizing ulcerative gingivitis, which is associated with anaerobic bacteria. And hydrogen peroxide, however, is irritating to tissues. And if used over a number of days, it promotes a hairy tongue, hypertrophied papillae of the tongue, and a decalcification of tooth surfaces. Now, hydrogen peroxide at a little bit higher concentrations is actually used as a bleaching agent to whiten teeth, but it does tend to be irritating to the tissues of the mouth, hydrogen peroxide. But it is very effective in killing bacteria and fungi, and also effective in being antiviral. It has been used as a oral rinse in these days of COVID-19. 1% hydrogen peroxide solution seems to be effective. It is known to also destroy or disrupt the HIV virus, the AIDS virus. There is urea peroxide. Again, it gives off oxygen, and it goes under the various brand names. And other oxidizing agents on page 6 include zinc peroxide. And zinc has been known to be effective as an antiviral agent. Some people, you may have heard, are taking zinc right now, supplements, to reduce their risk of the growth or proliferation of the COVID-19 virus. People suggest taking zinc supplements to reduce your risk of cold viruses, and it's combined with peroxide, which gives off oxygen. Benzoyl peroxide is found in Oxy 5 and Oxy 10, which are applied topically to the skin for acne, especially effective against anaerobic bacteria. And potassium permanganate gives off oxygen, and it's an oxidizing agent as well. So anyhow, you should know the importance of oxidizing agents. And we had mentioned a little bit earlier, Zoe, zinc oxide eugenol. So that's where zinc oxide and eugenol are combined. The last class of antiseptics we're going to mention are the iodine compounds. In general, halogens tend to be bactericidal and fungicidal, and even effective against viruses. When we say halogens, that includes not only iodine, which is the most important, but chlorine and bromine and others. But the most important is iodine. A 2% iodine solution is bactericidal and fungicidal and virucidal. So it's very effective. Iodine has the advantage that it's very low toxicity. It does not irritate tissues, but it can stain them. It's probably the single best antiseptic available. Here in this graph, it just shows different antiseptic agents being used to reduce the number of bacteria over time. This indicates the percent surviving bacteria over time. And you'll notice that the agent, iodine, right here in a 70% alcohol solution, seems to kill bacteria the fastest and to the greatest extent. On page Q7, so there is a form of iodine that's the most commonly used form now, povidone iodine. It's iodine combined with an organic compound. It releases iodine gradually. A 0.2% povidone iodine solution is what's used as an oral rinse against bacteria, fungi, and viruses, including the COVID-19 virus. It has the advantage that it does not stain tissues like pure iodine does, and it is not irritating. So that's iodine. So in summarizing the various classes of antiseptics, so we mentioned the phenol derivatives, like phenol, which include eugenol, and which is clove oil, and thymol, and others. And a second class we mentioned are, let's see, where am I here? Yeah, the alcohols, including rubbing alcohol, isopropyl alcohol. A third class are the biguanides, which include chlorhexidine, which is very effective. Antiseptic and disinfectant, and the surface active agents, which disrupt the surface of bacterial cells and fungal cells and so on. And then the oxidizing agents that give off oxygen. And finally, the iodine compounds. We mention on pages Q7 and Q8 a number of mouthwashes that are commonly used and indicating which antiseptic they contain. And we mentioned that mouthwashes typically have a surface active antiseptic agent, that's most common, and some flavoring and colorings and so on. So that concludes the brief overview of antiseptics. And we made a distinction between antibiotic, antiseptic, and disinfectant. And you should review those words and understand the difference. Be well, everybody.